Welcome to the Wellness Surge podcast with Dr. Adeola Oke. Each week, we discuss our wellness journey with real people like you and me. We have conversations about food, fitness, mental health, financial wellness, and much more, so you can get back to the real you. To make sure that you're up to date with this and other wellness topics, visit wellnesssurge.com. Information presented here is for educational purposes only and is not intended to diagnose or treat any disease. Please do not apply any of the information presented here without first speaking with your primary care provider. Now, let's head on to the show.
Hello, everybody. Welcome to the Wellness Surge podcast. My name is Dr. Adeola Oke, and I'm the host of the Wellness Surge podcast. And I have with me today Dr. Lola Adeyemi, and we're going to be talking about the culture of health. So hello, Dr. Lola. Say hello to everybody.
Hi, everyone.
Nice to have you here. So
Thank
Dr.
you.
Lola Adeyemi MPH, MLA, is a multipreneur. She's a physician by profession, but an entrepreneur by design. She runs a preventative health service organization called Magna Carta Health that was designed to help people improve their health with the aid of technology. Beautiful. Magna Carta Health was established in 2014 and was bootstrapped to success, all right? Bootstrapped to success. She currently services approximately 15,000 patients a year and counting. Her latest startup, Mentoring Her, is a social networking platform that uses machine learning to virtually connect female mentors with mentees to create remarkable relationships, which significantly increases their full-time potential. So do you guys see the connection here? She loves technology and harnessing the power of technology to better other causes. That's a win-win situation right there.
Absolutely.
So Dr. Lola received her medical degree from Olabisi Onabanjo University in Nigeria. She also received an MPH from Johns Hopkins University and an MLA from Harvard University. It's so wonderful to have you here. And actually, I also have a personal relationship with Dr. Lola. She was the person that held my hand and dragged me, was like my mentor, right? She mentored me to make my premium super green powder. So I'm forever thankful to her for that. And that's where the connection comes in. So thank you for being here. Thank you for all that you've done. All right.
Thank you for having me.
Awesome. So today we're talking about the culture of health. So what is a culture of health?
So the culture of health is actually is the conscious appreciation of one's health and the purposeful actions towards achieving optimal health. Right. The World Health Organization defines health as a state of physical, mental, and social well-being, not merely the absence of disease and infirmity. And with that definition, you can tell that we need to pay attention to our whole body and our whole health, right? And so that's really what the culture of health is, paying attention to your health and doing everything you can to achieve that optimal health.
Yeah, very good, very good. All right, so okay, we know we should be paying attention to our health and everything else, but how can this make us successful, right? How can this culture of health make us successful?
It makes us successful because when you pay attention to your health, when you imbibe a culture of health, you prevent a lot of things from happening. It's more of preventative health, right? And when you do that, you prevent disease, disability, and that's a win-win situation, right? That's what we want to do. We want to make sure that, hey, you either don't get the disease, or if you do have the disease, the outcomes are better. And so those are the benefits of having a culture of health. You potentially live longer and healthier lives.
Okay. Yeah. So from my experience, right, people just want quick fixes, right? Nobody was like, prevention. What's all that, man? Why do I have to prevent? And seriously, from working with patients and stuff, they just want quick fix. Oh, what pill can I take? But what I'm getting from this is this. If you prevent your health, say, take example for like stress, right? Most people don't realize that stress is a big deal. It plays a significant role in your life. And if you're stressed and you don't control that, it can lead to high blood pressure, right? And it can lead to stroke, disability, death, right? Yeah. Just one thing, if you nipped it in the bud from the get-go, get the right sleep, exercise, eat healthy, stuff like that. Things you consider expensive right now, right? Because I don't have time to exercise. That's expensive, right? Things that consider expensive right now, later on you may have to pay for them, right? Is that what I'm getting?
Absolutely. And the thing about it is that people don't realize that, a lot of when you get sick, it's not one thing that makes you sick. It's a multitude of things. There's several factors associated with illness. There's the social determinants of health, for instance. But when you get sick, it's not just because, okay, yeah, you were exposed to a bacteria or a virus. That's true. But what led to that? What exposed you to that? And okay, and that's one thing. So what if we can prevent those situations from happening? That's number one. Number two, the other things like, okay, you already have a chronic disease like hypertension, for instance. How am I going to live longer and healthier? One is obviously taking your medications, which is great. Two is going to see your doctor at the regular times. But there's so many other things because there's so many other complications and sequelae of hypertension that we need to pay attention to. Number three, you need to keep informed, right? Paying attention, listening to podcasts like this, but paying attention to your whole health, imbibing the culture of health to say that, hey, I care about my health so much. I need to make sure that this hypertension does not kill me because it can, but it doesn't need to, right? Making sure that if you're hypertensive, you have a low salt diet, understanding that if you're hypertensive, you need to work out and have a healthy lifestyle, identifying that if you're hypertensive and obese, that does go well together. So you need to have some type of exercise regimen that will help you lose weight, and on and on and on.
All righty. So are there like any actionable steps? Like, okay, we know culture of health. It's like sometimes people hear these things, right? But they need like someone to break it down for them. Are there like actionable steps in order for us to be able to start to incorporate and introduce this culture of health into our lives so we can live the successful lives we want?
Yeah, so I think one of the issues with embracing a culture of health has to do with the lack of understanding of what it entails and how beneficial it is, right? So let me quickly use a case study to explain better why it's important before I tell you the tips, right? So there's a typical young professional man who lives a busy life, anywhere around the world. He's 45 years old. He has a wife. He has 3 children. He's not a smoker, not a drinker. He just lives a normal, good life, appears to be in a general good state of health. And he only drinks alcohol socially. He works for approximately 9 hours a day. His commute to work is about 3 hours plus. His weekends are leisurely. He catches up on sleep, sometimes goes to events and things like that. But then he started having constant headaches, right? Which he attributed to stress at work. And then, he just takes some pain relief and he gets better. And then he noticed that he had some slight warming of his body, like he was febrile to touch and things like that. But he didn't think much of it. So fortunately, when he had that febrile to touch feeling, it was a Friday. And so the next morning he went this was in Africa, and then he went to see the healthcare physician. He went to see a nearby hospital, and they said, oh, he has malaria. And they treated him. In like 10 minutes, it was done, and then he went on his way. On Monday morning, he had felt better. And then he just kept on going. On Wednesday, his headaches returned, but he couldn't get to see the doctors. He was like, okay, he'll go back again on Saturday because, he's busy with work. And then took some painkillers. On Friday at work, he collapsed and he was dead.
What?
Yes. This is a true story.
What?
Yes. And
40,
this,
oh my God.
yes. And so this happens, this scenario but this could have been prevented because he was in Africa. They say common things occur commonly, et cetera, et cetera. They just completely assumed malaria was the only thing that was wrong with him. Mm. And he, as a young man in a place where malaria is endemic, he just also took it like, oh yeah, he doesn't go for checkups because that's the manly thing to do, not check your health. You don't check your health, right? And then because he doesn't have any obvious ailment, his body is fine, he looks good and everything, we have this false sense of safety and complacency, and so we're not proactive about our health. We take it for granted. And so we have poor health-seeking behaviors. And so to answer your question, number one, you need to develop a health-seeking behavior. You have to see, I don't know what matters most to you, but what matters most to me is my life. And that should be what matters most for everybody, but everybody has other priorities, money, which is important, education, which is also important, but there's nothing that should matter more to you than your life and consequently your health, because if you have poor health, you're not going to have a good life. You know what I mean?
Absolutely, absolutely,
And
absolutely.
so number one is having a better health-seeking behavior. Number two is you need to do a checkup, regardless of whether you're well or you're sick, at least once a year. And if you can do that, that even takes off the burden off you that, okay, I don't know anything about healthcare. I'm not a doctor, or I don't even have the time or the wherewithal, the mental capacity to deal with this. Let me send it to the doctors to, I, I'm seemingly well. Like, hey, doctor, there's nothing wrong with me, but I want you to check me out. That is one single thing that you can do to help yourself. Because
Let
at
me
that,
ask you a question though, because people think that what age should they start going to see a doctor? Like, s-
everybody should see a doctor
every year, right?
every year. I take my kids for checkups, and there's nothing. In fact,
Absolutely.
yes, you do that. You know,
Yeah. I go
there's
for one. You don't say because
yeah,
I'm 40, now I can go, right? In your
yeah.
20s, you still need to go.
That's absolutely right. It's not, you don't start because you don't start living at 30 or 40 or 50. No. But I mean, 30-year-olds have cancer, 40-year-olds have cancer, 20-something-year-olds have cancer, unfortunately, you know. But what it is that they don't have to die from cancer. 30-something-year-olds have high blood, 20-something-year-olds have high blood pressure, but they don't have to have that high because there's a pre-hypertensive state. There's a pre-diabetic state. We can catch it at that time. So that's what we want to do. So one thing you can do is go for a checkup. And that would take, it wouldn't solve everything, right? Because you go for a checkup and then you go out and then you start drinking 5 bottles of beer a day. That's not going to help you.
Absolutely, absolutely. Okay, very good, very good. Okay, so okay, alrighty. So what I'm getting is this: is we just need to be more open and just don't. Sometimes people just don't want to hear it, right? They don't want to go to the doctor because that they say when I go to the doctor, that's when they find something. True, because there was something there, right?
Absolutely.
Because there was something there to find. If there wasn't, they wouldn't find it. So,
Yeah.
so are there any other actionable steps?
Yeah, so yeah, obviously go to the doctor, but then also in yourself, you need to learn about yourself. You understand your body. Some physicians say that pain is good for you, and I agree because that's the way that your body is telling you that there's something wrong, right? And so know yourself, right? Know because a lot of times, sometimes our body gives us telltale signs that there's something wrong with us, but we don't pay attention, especially men, right? They say, "Oh, I'm okay. Oh, this you can't do that." I know that sometimes, and this is a women actually push things off that, oh, because they're busy, because they're super women, because they're super moms, they pay attention to their bodies, but they don't do anything about it because. But the point I'm trying to make here is that you need to pay attention to your body because sometimes your body is telling you things that you need to pay attention to. Because when you do pay attention, it makes a difference between stage 1 cancer and stage 3 cancer. And then the outcomes, you living or dying from cancer.
Absolutely. Absolutely. Even I think simple things, right? So I'll give an example about myself. So normally I don't eat like a lot of carbohydrates, but I think last weekend we were going on a trip and I was like, oh, my husband bought some ginger ale. He had juice. It has sugar in it. He bought some other things. And you know what? I drank it and you wouldn't believe it. That evening, overnight, I could not keep my eyes open. I was so tired. So simple. And then I was like, oh no, my body does not like the sugar. It drains me of energy. I cannot be a productive human being if I eat sugar. So simple things like that. I think it's because if my body doesn't like it, that means it can cause other things, right?
Yeah,
Because it doesn't
absolutely.
like it, it can lead to other things. So little things like that, just pay attention to your body, even if you're a superwoman, right?
Exactly. Pay attention to your body. And then another thing is that there's a lot of myths associated with healthcare. You need to forget those things. Things like, oh, I'm too young. I think we tried to talk about it earlier. I can't have a serious problem because I'm young and healthy. Stuff like that. We have some traditional myths, depending on what part of the world you're from, that stops us from coming. And then even mental health. This is where mental health comes in, right? Because for me, mental health is actually part of having a culture of health. Your mental health is really, really important. You need to pay attention to your emotional and mental health because it feeds into the rest of your body. That there's some subjects that are taboo. There's not, and that men they never get depressed. That's not true. And that kids do not get depressed, or they don't have anxiety and depression, and they're too young and that we're putting into their minds when we talk about it. No, you need to pay attention to your mental health because it's all part of your body, So that's something else you need to pay attention to, that we can do, or we need to focus on, that we're not doing enough.
Absolutely.
And find somebody to talk to. There are a lot of organizations like mine that are actually paying attention to people preventatively and helping you imbibe the culture of health to say that, hey, okay, what are we going to do? I know this healthcare system in the United States is seen not to be productive, that, okay, you just go in, you get treated, and you get out. But some doctors will take the time to sit down with you and say, okay, tell me what's going on. Somebody will come in with one thing. By the time we're done, we find out that it's something completely different that is wrong with you. All we have to do is take out time to actually listen to them. And so the point is, they're physicians and healthcare providers, nurses, nurse practitioners that are willing to help you. And so seek out somebody to talk to.
Yeah, absolutely. And even if like the physician is like, say they're busy, they refer you to somebody else that will take, like, say, a nutritionist or pharmacist, somebody that can take the time to actually delve deeper, talk to you, be your cheerleader so you can achieve your goal. That's what I do, kind of thing. So yes, absolutely. Thank you. Yay. So I hope people, because from experience, a lot of people that I know don't go into prevention. They don't see the need to do this or do that. Like, you're just wasting money. Why are you doing that? Blah, blah, blah. I'm like, I'm saving money for the future. That's it. And just, you can choose to save life your way, but I can see, like, oh, you're always on a diet. Yeah, you don't eat this. You don't do. Come on. Yes, this is my way, and I hope you can choose what you want. But this is my way of doing things, because I think prevention is better than cure.
Absolutely.
Yes. So we've kind of gone around a lot, right? We've kind of talked about a few things here today. One thing, do you want to make sure that people get away from discussion today, even if they if they kind of like glossed over everything else?
Okay. How I would like to end this is that if you do not make time for your body and your health today, you are going to make time for illness tomorrow. There's no doubt about it, because the body is like a machine that one day will break down. There's no machine that can go on and on and on, right? At one day and one time in your life, you will get sick. You will be ill. And so you need to prepare for that time. And so to prepare for that time, it's like a tune-up, right? You need to get tuned. Your car needs to get tuned. If it doesn't get tuned, it will either one day, it will just break down completely, and you're never going to be able to fix it again. I don't want you to get to that point where you're never going to be able to fix your body again, because that's death or disability. What I need you to do is pay attention to your health now by making sure you do your health checkups, empowering yourself with knowledge, having a better health-seeking behavior, improve your lifestyle, use gadgets. I mean, there's the Fitbit, there's all that bit, and so many bits. Just walk. If you decide to start walking today, 1,000 steps, 2,000 steps, it's going to change your life. It all matters. There's nothing too little. If you didn't do something yesterday, but you decided to do it today, it all adds up. So please make time for your health today, so you don't have to make time for illness tomorrow.
Very good, very good. Awesome. That was a good one. Alrighty. So how can people get a hold of you? Say they want to follow up with you after the show, or actually they even want to learn more about Magna Carta Health or mentoring her.
So they can go to our website. It's www.magna, that's MAGNA, Carta, CARTA, Health. That's HEALTH.com, or they can follow us on social media at Magna Carta Health. We're on Instagram, Facebook, Twitter, and all that kind of stuff. You can find me on social media at Dr Lola Adeyemi everywhere on social media, and then on Instagram and all that, LinkedIn. You can just add me and things like that. And then mentoring her as the name, mentoring her, not mentor her. mentoring her, www.mentoringher.com. And we're on social media as all of that name as well. And then you can also reach out to you. They can reach out to you, and then you'll find me.
Absolutely. So, okay, very good, very good. So mentoring, I'm a little more interested in that though. What does mentoring her, like I kind of said it, right? But break it down for us.
So mentoring her really is an offshoot of, so I'm obviously female, and I'm an entrepreneur. I'm a physician, but I'm also an entrepreneur. And I realized when I was getting an award for entrepreneurship, there was a conversation about the fact that women mentors were hard to find. And so I decided to change the narrative. And that's why I started mentoring her, to enable women mentors to connect with other women through technology, because I realized that was the easiest way to do it, to break the barriers of access that women have in mentoring one another because of our multiple roles in society. And that's basically how mentoring her came about. It was my way to somehow support women folk and girls and women. And so it's an online virtual platform. Everybody's virtual. You can be anywhere in the world. And it breaks down the barriers of access, time, geography, social, economic, and demographic status. And so you don't have to know anyone, and you just come there, you apply to be a part of the community. We do some type of background check on you, and then you join us, and then you just connect, and you find either a mentor or a mentee, and then you guys just help one another form meaningful connections. It's not a LinkedIn, you just say, hi, I have followers. No, it's not an Instagram that you follow. It's something that matters, that says, hey, Adeyemi, I need help about this. You're a pharmacist. You've done this. I want to be a pharmacist. How did you get there? Oh, hey, Dr. Lola, I want to be a physician. Or I'm a physician, but I want to do this. Or I want to change my career. Or I have problems with school, or anything you want to do. And basically, that's what it is. That's
absolutely. Yes, I was very interested in that because, yes, like I said, Dr. Lola was my mentor that held my hand in my, like, from product creation with my idea stage of coming up with different ideas for my thing, and how I was actually using this thing to make my own product, but how did I go from step A to step B to my final goal? So I always, like I said, I will always forever be grateful to you.
Thank you.
Alrighty, so this was a wonderful show. I hope you learned a thing or two. Prevention is better than cure.
Absolutely.
Grab your body today so you don't have to take care of the illness in future.
Sure.
Alrighty, hope you got that. I'll see you guys all have a wonderful week, and I'll see you in the next episode. Bye-bye, everybody.
Bye. Thank you.
Thank you for listening and sharing your precious time with us. If you enjoyed the show, then follow us and subscribe on iTunes, YouTube, or any app that carries podcasts. Have an awesome week. Best wishes to see you thrive.